Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology. As soon as a patient is diagnosed with cancer, they employ a lot of coping skills. And sometimes you even learn new coping skills, ways to address the way you're feeling, especially if you're having anxiety or depression. And there are many people who are available to help you with that. I find that some patients reach a point, it could be early in the treatment or later, where they think that their coping skills are just not carrying them through the emotions that they have. That even though they're employing good coping skills and maybe learning new ones, they're still feeling a lot of anxiety or even depression. So, is it common then, many cancer patients wonder, to take an antidepressant or to take an anti anxiety medication? It is fairly common and it's certainly understandable. There are times when you need a little extra help. What are those times? Well, especially if your feelings or your emotions are interfering with your sleep, if they're interfering with your functioning and everyday activities, if you find interference in relationships, or you just can't lift your mood, even with all the different ways that you know how to cope, that's a good time to talk to your doctor and see about getting on either an anti anxiety or an antidepressant. Many patients are concerned about getting on more medication because they really don't want to start something that they'll have to do forever. So the concern is, am I going to have to take this for my lifetime then? Am I now going to need an antidepressant or an anti anxiety even after cancer treatment? And the answer is not necessarily. Usually, anti anxiety medications, antidepressants, are a temporary solution to the feelings and the mood changes and the difficulties you might be having while you are going through cancer treatment. Some patients find that even 6 months or even a year afterwards, they're still overcoming some of those feelings, especially if certain things were particularly traumatic or difficult for you. So, that would be a good reason to stay on an anti anxiety or an antidepressant. Other times, patients find that they've now discovered that they actually had an underlying anxiety disorder or underlying propensity for depression, and they're happier on an anti anxiety or an antidepressant. And then again, there are those cases where this was simply a temporary fix. And soon after your anti cancer treatment that you go through, soon after you have recovered and you're back to a normal life, you're back to your usual routine, you don't find your mood or your anxiety interfering with life, soon after you can stop the medication and you won't need to take it again. Never abruptly stop any antidepressant medication. Always consult with your physician first if you're getting off either anti anxiety or antidepressant medication, but you can slowly wean off the medication and test and make sure that it's time for you to come off the medication. So it's very normal for your body chemistry, which then affects, of course, your thinking and your mood and your ability to deal with the various challenges of cancer treatment. Very normal for that to require a little extra assistance by getting a medication. And it's very understood. It's certainly something that you should address with your physician if you think it's something that you need.